Hi, I've been asked to talk about responding to questions that you had about psychedelics in medicine, the use of psychedelics in medicine. So, what are psychedelics? They are chemical substances that they have mind-revealing capacity. That's what psychedelic means. The research shows that apparently, when we are children, our different areas of the brain are able to communicate with each other much better. And as we grow up through upbringings and education and trainings that we get, uh, our brain becomes compartmentalized, and different parts of them that they used to be able to connect with each other, they have less communication or no communication based on the training that we had. And also the coping skills, poor coping skills and habits will interfere with that ability as well. So in, um, in the world of psychedelics, it's no different than when you're using antidepressant medications. It's usually not just the molecule that will help. It's the whole person approach and with the guide usually that would create the mindset and the setting that the person would feel safe and would benefit from the effect of psychedelics. So what psychedelic does is that it will create an environment for the brain that different parts will start to communicate with each other. And the person is more susceptible to accept suggestions. That's why adding psychedelics combined with therapies would be beneficial for people with treatment resistant depression and other medical conditions. It's been used for some pain conditions as well. For example, for types of headaches that are not responding to any other type of treatments, like cluster headaches. It has been helpful. And it appears that for some intractable neuropathic pain, there are some effects. And there's a lot of literature about use of things like psilocybin or other psychedelics for depression cases that are not responding to other treatments. What's important is that luckily more fashionable these days, and anything that becomes fashionable, people will have more acceptance and receptivity about it. But the problem is that you should never think that because it's fashionable now, it's safe. There is no chemical substance that you can use, whether it's natural or synthetic, that is safe for everybody. And you can't say that everyone would have complete carte blanche to use them. The person be evaluated by a healthcare professional that is experiencing especially mental wellness and physical wellness assessments, and then look at the condition, look at the diagnosis, the treatment that have been used already, and then make a decision about using psychedelics or not. In many of the countries and cities, psychedelics are not legal, so it's mainly being used under research protocols. There are one type of psychedelic in US and Canada that are being used, and that's using ketamine in the form of infusion and also in the form of nasal spray approved by Health Canada and FDA that is called esketamine. That would basically create an environment for brain that be more susceptible for getting proper guidance to somebody who can give them proper training and proper um, guidance related to how to learn new skills as a part of the therapy that would help them with the current condition and then hopefully will stay with them for the rest of their lives. I keep receiving these questions from you. I'll try to talk more about mental wellness and mental health as we go. And then from time to time, I'll also update you about the use of psychedelics in medicine, especially in mental wellness. Stay well, stay safe until our next contact.